Hello, we are from Touro University California. This project for Prescription Surveys of 2019-2020 is known as MedTalk Center, MTC. This is a medication therapy management phone web service by intern pharmacists. Our mission for MTC is to encourage medication knowledge and adherence within the community through open dialogue between patients and healthcare students. There are 3 goals that we set for MTC. 1. Providing medication therapy management to non-mobile and community members. 2nd, giving future pharmacy student practice with patient interaction. Finally, facilitating collaboration between community stakeholders and local government for potential revenue and healthcare savings. Medication non-adherence is defined as patients taking less than 80% of their medications. For example, if you're taking an antihypertensive medication once a day, missing just 2 doses a day in a week will put you in this category. 1 of 3 people don't fill the prescription, and 3 out of 4 don't take their medication as directed. This led to a cost of $290 billion per year. There is a bucket leak in pharmacy prescriptions, meaning that from the start of the prescription written to getting refilled as prescribed, there is a huge decline in number of patients involved. Another issue that patients face is polypharmacy. Statistically, as you get older, you are more likely to have more medications. There is an estimate of 30 to 40% of elderly patients that take more than 5 medications. Our solution to the problem? We are providing medication review to the community via student-led appointment-based call center. We're aiming to serve patients and caregivers, especially those who are non-mobile. The benefits of MTM, according to this study, shows that providing these services will help reduce costs for healthcare systems. Also, a STOMP study showed that the test groups with MTM showed a significant improvement in medication adherence and clinical outcomes.
This program will help both students and the community. Students will get the opportunity to practice providing medication education and patient counseling, drug-drug interaction checks, and answering questions regarding medication indication and direction. In turn, the community will see better health outcomes, medication understanding and adherence, while reducing overdose and duplication of medications. Together, these efforts will help decrease healthcare costs and foster communication and connection between the community and students. The impact of MTC depends on how many stations are established. For example, if we have 4 stations, we can help 4,480 patients per year and save an estimated $361,200 for healthcare systems. MTC will provide medication review and management during a 30 to 45-minute interview from 4:30 p.m. to 8 p.m. on Mondays through Thursdays. Patients will have sent in medication lists several days prior to the appointment, and students will have worked up these cases and reviewed them with a preceptor as well. During these interviews, students can also provide lifestyle modifications, naloxone recommendation and training, amongst other services. To wrap up the session and ensure continuity, the program will provide a summary of the call by mail or email. Solano County also has a contract with Meals on Wheels to provide meals and check-ins on patients. We will be partnering with Solano County and Meals on Wheels to help these patients fill out their medication lists. Depending on what time these visits happen, we may also be able to webcam with these patients as well to help them fill out these forms. Here is a version of our release form as well as our medication list. In summary, we're hoping to set up this program to help reduce medication errors, improve adherence, and patient quality of life. We envision this program being applied to several different settings within schools and pharmacies so that communities can benefit from having such an accessible and local healthcare practitioner.